The next issue we'll be talking about today is what it takes to be a bilingual SLP. This is an issue I think that a lot of people are interested in, and having worked in various parts of the country, I know that different agencies, different educational settings do have different things that they look for, or potentially that they don't, that it just be language proficiency. So this is a good question for Dr. Brice. What, in your opinion, does it take to be a bilingual SLP?
Thank you. As we know, a lot of folks are referring to themselves as bilingual SLPs, speech-language pathologists. And this was a question that was posed to the ASHA Multicultural Issues Board just recently, and they came up with a preliminary definition. And it involves three aspects. And the first aspect is, of course, we're talking about proficiency level in the second language, the other language, at a high level of proficiency. In other words, to be able to communicate, be able to diagnose, and be able to treat in that language, also be able to talk to other professionals in that language. And so we're asking individuals to be at a near native or native-like abilities in the other language. So we're talking about the language levels. Mm-hmm. The second one is having to do with knowledge and skills, a knowledge and skill set of how to appropriately evaluate bilingual, trilingual, polyglot individuals, how to treat individuals in two languages. So we're dealing with the knowledge of speech-language pathology as it applies to bilingual learners. And then the third aspect is to be culturally competent, to be able to transverse and to culture switch and appropriate, know what's appropriate and the culture that they're working with.
Mm-hmm. So the cultural competence, obviously the language piece, and then the knowledge and skill set
yes,
to go with it. And now I'd like to follow up on that question a little bit more, specifically for students coming into the program, pursuing a graduate degree, who already speak the language and who wonder what else they need to develop this skill set, this knowledge and skill set that we're talking about. So how would you address that question for students, again, who already speak the language but don't know if that's sufficient or what else they should pursue?
That's a great question. Because it's not just speaking the language that qualifies you as a bilingual speech-language pathologist, and a lot of it relies on the knowledge and skill set. Mm-hmm. And this also applies to monolingual clinicians, to be able to work with other individuals who are bilingual. And what is that knowledge and skill set? Well, it does involve taking additional courses in terms of appropriate assessment. It does involve taking courses and doing practicum in terms of providing services to clients in the other language or in a bilingual fashion. And if you're looking for a bilingual emphasis program, the program should also offer you practicum hours. Mm-hmm. in terms of working with bilingual clients to round out that theoretical class information to the actual practice of working with bilingual clients.
Mm-hmm. And so really I think that makes sense. So even for clinicians who speak English, it's a similar question. Speaking the language doesn't make us qualified to evaluate and treat that language. Students still take language development courses, language disorders courses to even
just because you speak English doesn't make you knowledgeable about language development and language disorders.
Yes.
Also, another key point is that for example, we're both bilingual and speaking Spanish, but I've had the opportunities to work with Navajo, American Indians. Mm-hmm. I've worked with individuals from Taiwan, individuals from China in terms of a second language. Mm-hmm. And I'm not proficient in those languages, and so I've had to enlist the parents or enlist somebody as an interpreter and translator. Mm-hmm. And so there's also the knowledge and skill set of working with other individuals when you don't speak that language.
Mm-hmm. Exactly. So a lot of the knowledge and skill and even awareness of what appropriate assessment methods are, different modifications that might be necessary to more appropriately evaluate and work with speakers of other languages. Okay, great. Thank you.